lovely picture right here.
Oh,
This is
thank
Cool
you.
Beans. This is Cool Beans.
Thank
And
you,
there was
dear.
some people in here that was really pushing for us to put funding towards sickle cell anemia. I'm not going to mention the clerk's name also. You know, Councilman, push that money forward. Yeah,
We
she's in it.
sincerely appreciate it.
That's important. We'll always be there to help sickle cell anemia any way that we can. Just a lot of people don't know about it, and I do. I know about it. The trade is in my family, you know, so I know. I remember being a kid, and my mother mentioned about sickle cell anemia. She has the trait. She thought she has some kind of tropical disease, but it's from that area, from the Mediterranean. And then she found out, she like, what is sickle cell? And we all ran to look up, to research sickle cell anemia, and we studied it. And then I would join different groups to help out and with fundraisers. It was a cat there named Kevin.
Jenkins,
Yeah. So where is he at now?
I don't know where he is. He also has a son. And Kevin, he was one of the affected families members.
Mm-hmm.
Yeah. I'm sorry. Yeah. Okay. Which is a totally different service component than what we are.
Right.
And all. But no, he hasn't been involved in many, many years.
Many years.
Yeah.
He made me aware of it. We used to do events for sickle cell anemia at Corey United Methodist Church.
Yes, we did.
Yeah,
Yes.
I wasn't a councilman at the time, but I was an activist.
And you probably worked with Ford, Lewis, and Turner, the pediatricians, who were really doing a lot of work with
They were.
pediatrics, sickle cell.
We talked to University Hospital,
Yes.
got them on board with it, and so we just opened it up. Like Kevin, and my assistant, Naomi Marshall.
Yeah.
I was doing a fatherhood initiative.
Yeah.
We were doing that.
She was
and
one of our board members.
Just an appointment.
Yeah, okay,
Yes,
yeah. So
She
you
did
see,
a lot of events. She did a lot of
Yeah.
events with us. Yeah.
yes, Naomi.
Yeah, and it was, the illness was just very devastating with her. And that does happen with some of the individuals who have the disease. But she really had a difficult time throughout her life with it.
Yeah, she did. I understood. Even when she couldn't make it in, we bringing back memories, and when she have a sickle cell crisis, go to bat for her. And I understood. I was her boss. I never terminated her or anything like that. And I was always there because I had the knowledge to understand what's going on.
Yeah, she's really missed. She was one of our really active board members.
Got two friends, active board members, Naomi and Kevin. Kevin was the 1st one after my mom's told me that we had a trait. So we probably, with that trait, I'm looking at it, I know we came from the West Coast, looking at the background history of my family. Probably from Senegal or Nigeria, that area right there. It's a lot dealing with sickle cell there.
Yeah, it mainly was really identified as a result of malaria, that the mortality and the morbidity rates were very low with individuals who contracted malaria and also had sickle trait.
You know, building the Panama Canal, people were dying and dying, but the ones that they mainly got to build the Panama Canal, because the Europeans couldn't take it, and they would give money in silver and gold, and the black people would get the silver, and the white people would get gold. And they brought in people who had had the history of having sickle cell anemia to help to dig out the Panama Canal, because people were dying of malaria.
Malaria, right?
And I helped it out with it. See, I studied it, man.
Yeah, you did.
I studied it. No, I
appreciate that.
Okay.
Because I don't know if you remember when I came and did a presentation to you about the sickle cell, and we did several health fairs that you were chairing in your ward.
Yeah.
Yeah.
Sounds like the councilman.
Yeah.
I don't remember really. I've been around a long time. And I just, when was this? In the early 2000s?
Do you remember where's Alexander restaurant? Alexander? The restaurant, that's the
We
area.
did the school.
Yeah, the school.
The
And
school,
that's
yeah.
the first time I saw Mr. Conway. Yeah, in
Yeah.
the presentation. He was doing a presentation with our
Right.
community, and he was there as invited, one of the tables, one of the vendors.
Yeah, we would have a table.
Yeah.
And I met with you also with Stacy Polk.
Yes, Stacy. Stacy, good friend of mine, a lawyer,
Yes,
Stacy Pope. Good friend
because
of
her mother, Anita Polk,
mine. Yes.
was one of the founders of the organization.
She did tell me that. Stacy stops
Yeah.
by the house a lot, and Stacy, the attorney, and she told me that is true. Mother was a great person. That's true. You know, with Santana, I talked with her about it also, so she supports it. Dealing with the sickle cell, she knows, and she supported. We were stopped to talk with her about it. She's not on this committee, but she supports it 100%.
I worked with her when she was in Metro for years, as education in the community, and she brought me for so many events for the Amigas, you know, and that's when she learned a lot of stuff about the sickle cell. And now we are the second race, you know, after the African Americans, because we're multiracial, and we are affected with this disease too.
I know. We have some Spanish people that's here in the city was telling me about it also, but I knew about it, you know, because during the Middle Passage, a lot of our people went through Puerto Rico and the Dominican Republic, and so I had an understanding. I had a good understanding.
Because we have Italian, don't forget that we have Italian background, Mediterraneans, Italian carried the trade
They
for
did.
years and generation.
Greeks,
And that's my
Turks.
Greeks,
Yes.
and that generation went to Puerto Rico and the Caribbean too. And that's where they come from. A lot of African Americans, we believe, you know, carry the trade, I mean, African Caribbean. But the most you can see the variation of the hemoglobin, the disease, you can see in the Mediterranean too.
Yeah, the Sicilians.
Sicilians, Italians, Mediterraneans, yeah, Turkeys.
I know we carried it during the Punic Wars when we went up there and we fought the Italians during the Punic Wars. The Moors carried it up there a lot, and so we talked about it. My mother told me we had to trade. I went studying. So we walked there. I know. So we opened, and many of the council members here donated. We took a form around, PIF, Project Information Form,
Okay.
and many of the council members put money in it, like that you see sitting here. They drop because you asked for a certain amount, and we gave more than a certain amount that you asked for.
Yes.
Because I asked, the council lady and the council lady and the councilman. Like, no problem. Nobody had any problem. No one pushed back at all. That's just how Cleveland City Council. That's what we do. So you can give us the background history. You want to know more about it?
Okay. Well, first of all, I would like to thank the committee for inviting us. And it's always a part of our work to be able to educate the community. Because lots of people don't realize that sickle cell, as Gil has said, is actually in all races. They look at it as African American. It's more prevalent in the African American population, but everyone. And aside from that, as I get into the mission, when we do testing and health fairs and different things, we identify quite a bit of different what's called hemoglobin variants, which is a combination that can be combined with sickle and thereby creating sickle cell disease versus the more known one, which is sickle cell anemia. There is also sickle cell disease. And that's when we get into areas like sickle thalassemia or sickle C disease or sickle D. But sickle cell anemia was always identified as the more severe, but there's a host of different variants when it comes down to the combination. But here we, and you took it with, here we go with the mission. This is our mission. And actually, it started many years ago to do and provide comprehensive services through diagnostic testing, evaluation, counseling, supportive services to individuals and families at risk for sickle cell disease. This is our history. The agency or the organization was actually started in 1971. So we are 53 years into what we're doing. And it was founded by 7 African American physicians. And what happened was, as what Councilman has said, as a young kid himself, we looked at areas of mass screening in order to reduce the mortality and morbidity rate in the area of education, to let people know, because this illness was causing a lot of deaths in children. And so we started out doing what's called screening. It wasn't diagnostic, it was screening, and it was a screening process called isoelectric, it was called SickleDex, and it's a solubility test. And what would happen is you would see by the discoloration of the reagent that was being used, a cloudiness, but it only said that there was sickling going on. What type of sickling? Was it the disease or was it the trait? So therefore you had to go into diagnostic testing. And I'm really proud to say, as the American Sickle Cell Anemia Association, started out also working with core blood, that all the babies born in our region blood was taken from the mother's umbilical cord and went to the lab in diagnostic testing, and that's how we were able to see the mass normals of hemoglobin variants, thalassemia, C, even in the Jewish population, Heli Rosh Hashanah, that's one that's found. And the combination, as I said, comes with a person who has sickle trait, combining with one with the abnormal, like thalassemia, then you have sickle thalassemia disease, which is just as severe as sickle cell anemia. And sickle cell anemia is actually identified as homozygote, simply because all of the hemoglobin is sickle. And when you get into the heterozygous state, then you're into the disease and the trait, because it's a combination. If I was to test people with the trait, they would have normal hemoglobin and sickle hemoglobin, but that's 2 different variants, a normal and an abnormal. But with sickle cell anemia, everything is sickle. And so, as I get into it, I can talk a little bit about that. Here we have sickle cell disease is an inherited blood disorder. And that's one of the main focuses that we do, is to let people know that while it's more prevalent in the African American population, is in all races and all. And, it's, I don't know if we have a slide with the newborn screening to talk about that.
Yeah, we're gonna keep it in here.
Well, I'll talk about that in a few seconds. These are the services that we have. Actually, we're identified by the state of Ohio as the Region 5 Sickle Cell Program. And we have the largest at-risk population in the county, or in the state actually. And our areas of service is Cuyahoga, Geauga, Lake, Medina, and Lorain. We actually, Gil does, go into Geauga and follow up those patients. He goes into Lake and Medina and Lorain, and then there's the large county, Cuyahoga, where we see them actually in our office or at Metro or J. Glenn Smith.
Right.
Okay.
Jake Lance is-
Greater Cleveland, 20% of the area with carriers of sickle hemoglobin, and very
It is
high.
high.
Each year, we have approximately 15 to 20 newborns in this area with the disease. And that's where I talk a little bit about that. As we are designated by the state of Ohio as a Region 5 Sickle Cell Program, Ohio, along with the other 49 states, do mandate newborn screening. So let's say you went into the hospital and had a baby. Your baby would be screened for sickle cell, along with about 35 other screenings, which consist of PKU, galactosemia, hypothyroidism, and so on. But any of those babies that screen positive is referred to our organization. We're the ones that follow those babies up. And now they've had a screening called isoelectric focusing screening, and that's what that is, a screening. What they now have to have is a diagnostic test. to actually confirm what it is. You know, nothing is perfect. You know, you have positives that are not positive or negative that are not negative. So you have to, follow them up. We follow those babies up through, and those that are identified with the disease, we will follow them throughout their life trajectory. And looking at, their needs, supportive services, ongoing treatment and management. Now, there is no cure for sickle cell. And one would say, well, then why are you all doing it? Why are you following them up? Why are you doing the testing? Well, we found a few decades ago, that studies utilizing antibiotic therapy would reduce, and did reduce, the mortality and morbidity rates in those babies. So by the time they're 3 months old, they are put on antibiotic therapy. And they will get that twice a day, 125 milligrams of amoxicillin. And they'll continue to get that throughout their early years of life. And then as they get older, they'll be treated for, they will be vaccinated rather, for pneumococcal vaccines and those types of things, but yes.
That's getting pretty big that you don't have to get off the subject that you mentioned it. I've been hearing it over and over again. The vaccine you just mentioned.
Mm-hmm.
It's the pneumococcal.
For pneumonia.
Right.
Because one of the problems with sickle cell was the bacterial infections that the children would get. And that's what led into death and high morbidity rates and mortality rates as well. So starting out several decades ago, that's the treatment that's being done. Early diagnosis, early confirmation, management through antibiotic therapy, and they have to be followed up by a hematologist. So once you have a baby and the baby has a disease, then that baby will see on a regular basis the pediatrician and a hematologist. And unfortunately, there is no cure for sickle cell at this time. And what we are looking at here is the agency's success throughout our inception and all. We have provided services to over 325 persons, and those services include education, testing, counseling, and of course supportive services. We do education programs. We work directly with the schools, and I think I mentioned this to Councilman Conwell. We're actually the only community-based program of this type in the country, where the Cleveland residents can actually call our office and make an appointment and come in and be tested. And they're not getting a screening, they're getting a diagnostic test. Yes. And with the funding that's provided to us by council, we're able to have this service at no cost to the consumers. And we're also able to provide them with comprehensive supportive services. Sickle cell disease carries one of the most highest health disparities than any other genetic disorder. And it's very unfortunate because what I've outlined to you is early diagnosis. Well, sickle cell comes with severe pain. It comes with major medical crisis. So if you've got a child, newborn, around about a year of age, they may encounter their first crisis. Then they're dealing with hand and foot syndrome, where there's severe pain in their hands, swelling in their feet. There was time when those rates were high, mortality and morbidity, when mother would say, oh, they've got a fever, I'll just give them some Tylenol or something. You can't do that with a sickle cell child. And so when they have a fever, they have to be, observation has to be put into place or managed. They have to be seen by the doctor because they're encountering a crisis. And one of the most common crises that persons with sickle cell encounter is called vaso-occlusive crisis. And that's when their arms ache, their abdomen, their back, their legs, all over the pain. We did a program with some doctors out of New York, And an example of what they gave as far as to identify the pain is think in terms of having a nail and a hammer, and you're about to hammer that nail as hard as you can into the wall. You miss the wall and hit your hand. That's how they express how pain with sickle cell is. And all. Now, the challenge, there's one, we'll get to that. Yeah, we can get to some of the challenges. Of course, program funding is always a problem. We get very little funding. We don't like to name call, but if you look at cystic fibrosis compared to what they get for funding compared to what sickle cell around the country gets, it's unbelievable. And yet, more persons are affected by sickle cell. 1 out of every 365 African American babies is born with the disease. 1 out of every 10 to 12 has the trait. So think in terms of you're in the room with 100 African Americans, statistically speaking, at least 10 of them have the trait.
Yes, yes, yes.
As the American Sickle Cell Anemia Association, based here in Cleveland,
Yes.
you were founded here in Cleveland. Are you the main national sickle cell
No.
group? Okay, so you have affiliates around the country, or how does it work?
We started out before the group that's identified as a national group.
I got you.
But our program actually provides service all over the country.
Wow.
You know, we get calls, and someone may call or send an email from Africa
Yeah.
looking for information, Puerto Rico,
Colombia, Venezuela,
London, all around the world.
UK.
We're fortunate, again, because of funding, to be able to provide this type of information to them.
So, yeah.
So that people can really understand this illness. We're affiliated with all of these
Oh,
hospitals.
it's wonderful.
Yeah, so we're,
and-
go ahead.
Oh, I apologize.
That's
No.
okay, go ahead.
I was just wondering if you thought do we know, does Cleveland have a higher rate of the sickle cell trait than comparable cities? Or, you know, are we sort of, how did we end up?
This 20% over here, you see over here,
Mm-hmm.
I've been doing this research for, I'm going to be in June 27 years working
Wow.
in American Sickle Cell, 27 in June, American Sickle Cell Association, translating languages,
Yeah.
you know, to English to Spanish, and to educate my community too about this illness. Through the time that I have, you know, we have a emerge program, who we send letters to diagnose, you know, to when they come with a diagnosis automatically for the lab, we send this letter to the mom and the doctors. That is when we have a merge, which is that data is in our computer, and that automatically give me the system how much in the area they are affected and they are carriers.
Yeah.
This is that I got the numbers from there.
Yeah. Oh,
Yeah.
got it. Wow.
Mm.
Well, thank you. Thank you for
Yeah.
Speaking of the fundraising, what you're doing right now, and anyone could jump in at any time. So how is your budget right now? What are you?
Right now, our budget is less than $295,000 a year, and a large sum of it is through Ohio Department of Health,
Which was cut off.
which constantly gets reduced.
They do.
And all. And one of the reasons why it's being reduced is because they're looking at Cuyahoga County and Franklin County, with Franklin County outgrowing Cuyahoga County.
What?
Yeah,
Oh, yeah.
yeah. So, but that's in essence what they're doing.
They count you more in basically in 2 or 3 years they have a more baby born in that county. That's the distributor
In
the
Franklin
money to
County,
go.
right.
You know, and that's wrong because they don't count the services that we do, you know, for these larger counties.
And see, there is another area. Several years ago, a young man who had sickle trait died as a result of it, and he was an athlete. And so the NCAA now requires, for the most part, that young athletes, regardless of their race, have to be tested for sickle cell. And in our office, we just had kids from London,
UK, Germany,
Australia,
yeah.
that had to have that test. And so they came into our office to be tested and educated with their coaches and different things.
Oh, Australia,
Yeah,
they had that
mhm.
test?
Yeah, we have,
For the athletes,
Yeah.
they take athletes from a different country and they're bringing over here
to go to
to
school.
go to school. You know,
And
for the
actually,
athletes.
yeah, actually, a large number of those athletes were out of Notre Dame University that's now closing. Yeah.
Very soon I'm going to have a program open for testing all the athletes in Berea,
Right.
over there in Berea, in the college in Berea.
And the same as far as,
Aborigines, they don't get sickle cell, do they?
but it's the hemoglobin
The hemoglobin
variants.
variance is there.
You know, there's hundreds of them.
1,600
And so when,
traits.
right, so when you look at it, and as I said earlier about sickle cell disease, when you look at, let's say that I have sickle trait and you have thalassemia trait, then we could have children with sickle thalassemia disease. But don't let Miss Cromwell know.
I'm gonna have her to donate. What I was gonna do
No,
was,
I'm only kidding by matching the two of us up.
I'm okay.
The community, let me give you about corruption. Oh, I'm sorry. The community for the Caucasians community and European community carrying the thalassemias and the hemoglobin D trait.
Right.
Those people carrying the hemoglobin variants, they met one other person with the trait. They started having disease baby out of that. And that's the situation.
For example,
You in there 27 years.
Like, thank for her. She's my teacher. She's
Okay.
my mentor.
What I'm gonna do, and I'll yield to Council Lady Gray in 1 second. You'll meet with me maybe sometime this week or next week, and I'll talk with my wife, and I'll give you her phone number.
what
And
an honor, thank
I
you.
want her to donate some money from the county, because she chairs the health committee in the county. And she wanted me to give her some things on sickle cell. Anyway,
Okay.
I'm gonna give it to her. And I'll talk with her about donating to sickle cell, but we'll sit down and we'll talk
Okay.
with her to get some donation dollars.
Okay.
Probably, just either we'll meet at my house or we'll meet at the coffee shop around there. And we'll sit down and we'll talk about it and see what can we do. And I'll get her to donate. That was on my mind anyway when I walked in.
Okay.
From there. Council
Okay,
Lady?
good morning, good
Good
morning.
morning.
Thank you for coming in to,
Thank you for
to
having
enlighten
us.
us about
I gotta wash
more
my
of
glasses.
information about the sickle cell needing disease. But the question is that last year, it was announced on the news that it was a breakthrough. On December 8th, it was announced that it was a breakthrough and approved by two sickle cell disease and gene therapies,
Gene engineering,
gene there for people 12 and older. Could you
12 to
kinda-
55.
12 to 55,
Right,
could you elaborate
right.
on that?
Yeah, actually starting out, the first one was bone marrow transplantation. And, you have to deal with the matches, with the siblings, and, the numbers were not that high, but it was a breakthrough in the sense that that was, I don't want to say a cure, but a management that those persons would not be enduring the pain and the crisis that normally would come as a part of sickle cell disease. But the gene engineering new work that's being done, right now it's in about 20 different medical hospitals. And we have Cleveland Clinic as one of them and University Hospital as the other. And that requires somewhere in the area of about 3 to 4 months of hospitalization because you're being treated with chemotherapy to remove and to replace genetically what's going on with the development of the sickle hemoglobins that the body has to keep producing. Now, that was just approved in December by the FDA. The second thing is it has just now been also approved by Medicare, I think it is, because that procedure is costing over $2 million per person. Yes. And so right now, it's 12 to 8,
35.
no, 55.
12 to
I think,
55.
yeah, 12 to 55.
So when they go through the procedure, how often do they still need to take the injection or the medicine to?
Oh, yes, oh, yes. And also, they will not have the disease, but they will still be producing sickle, but it won't be sickle cell anemia. And they can mate with someone with the fact that they would still have the sickle hemoglobin, and they can still have children with the disease.
They still can?
Huh?
They still can?
Yes, yes, yeah. But that's a powerful thing that's being, done now, and it's, again, it's a lot that the individual has to go through. It is not like you're going into the hospital to have like a colonoscopy or, polyps removed. It is a long process, and that process usually takes from 3 to 4 months in hospital. And, they lose their hair, because you're using the chemotherapy.
It's just- Even though it's a breakthrough, they still can, the cell can still be transferred to another child, to a child, and they will have the disease. So what's I'm just kind
No,
of confused.
that's
Switching, it's
if,
like a
if
switching the light.
two of them.
Okay.
Yeah. See, in order for you to have the disease, you have to have, it's autosomal recessive. You gotta have both parents have sickle trait,
The trait.
or one parent has sickle cell anemia and the other has the trait. And so when you have two persons with sickle cell trait, they have a 25% chance of having a child with sickle cell disease with each pregnancy. And that's the thing that we talk about and make sure we get our consumers to understand. That's with each pregnancy. Some persons will say, oh, well, my first child had the disease, so I can have 3 more that
Oh,
will
geez,
have it. No,
yeah.
that's with each pregnancy that they can have 25% chance of having a child with the disease. And we have some families that have 3 and 4 children with the disease. We have families that mom has the disease, dad has the disease, and of course the children have the disease. Because there's one thing that we don't do. We do not have a right to tell someone you can't have any children because you carry this gene. That's the purpose of the education, to educate them so they can make the decision. You have families that are told every day that their child is trisomy 21, Down syndrome, but it doesn't stop them from, going through with it with their children. And that's the same thing with sickle cell. As far as education and genetic counseling and those types of things go on.
Have you found in some of the families that maybe one child didn't get the trait or didn't get the disease?
Oh, yes.
Okay.
Oh, yes,
It's the
because,
generation.
right, do you have a pen?
That's what it did with us. Just give it to
Yes, it's
the-
generation. There's
Can I-
something like she was talking
Right.
about,
Can I
it's
use
the
your pen
generation.
for a second? You would have, these are 2. Like that, okay? These are 2 families with both parents have the trait. So you have a 25% chance. So this here, and then you have a child with the disease. Or you could have A, normal, and you have a child normal hemoglobin. Or you can have A, S, and you can have a child with the trait. And that's in each pregnancy.
That's in each
Thank you.
pregnancy.
The baby, the baby in the womb, right? The one gene
Right.
for mom, one gene for dad.
Right.
That's where it comes from for that. For the every genes, the baby had to get.
Okay.
Right.
So what about this breakthrough? Give me one second.
Genetic engineering.
That was,
That is the new treatment that's going on, where they're genetically changing your
that's
genetics.
crazy.
Yes,
It's switch.
right.
It would not. It's not a cure. It's
No.
switch the genes to
Right.
trait.
And here at, we've had several presentations being done, but Dr. Hanna, who's over that here at Cleveland Clinic, does an excellent presentation on that. And we've been collaborating with them as he do presentations to the public as well as consumers.
Chris?
I have a question.
No, I'm done, thank
I've
you.
heard you say a couple times the cells are sickle. What does it mean?
Okay.
The cells sickle.
Sickle,
Are we talking
okay.
about red blood cells, white blood cells?
Red
What are we
blood
talking about? What's
Red,
sickles?
okay, it affects your red blood cells, and I apologize for that, not to go into depths of that. It affects your red blood cells, which you all know that those are the cells that carry the oxygen throughout the body. When a person has sickle cell, as those cells are giving off oxygen, they take on a shape like a sickle.
Is that what this is?
Uh-huh.
Is this supposed to be a
That's our
representation
logo,
of
yes.
sickle?
1971.
That's our logo.
Yeah.
And they continue as they give off the oxygen of taking on, and they are no longer soft and flexible. They're now hard and rigid. So they began, may I see your pen again? They began to,
The cells are supposed to be kind of round and blobby.
right,
but
they
start
go,
to
right,
sickle, start to,
they
like,
pass
develop
through,
a function.
just like deer, okay?
Uh-huh.
But as they're giving off the oxygen, they take on the shape of a sickle. And they're no longer soft. And so that now they have clogged up the vessels. And that's when the pain occurs.
So they create a density within the blood.
A blockage,
vessels
yes.
itself
yes.
that
mhm.
blocks the
That's,
flow. And
yes.
It's like a chili horse in the
Right.
body, it's not going away.
And so that's what causes the pain.
That's
is the
right.
buildup of
That's right.
pressure
That's
inside
right.
the blood vessel.
And that's where blood transfusions come in. And that's why we also work with the Red Cross, because it's important that people do blood donors in order, because sickle cell patients use a lot of blood. They're not the only ones that use a lot of blood. But when you, even if they should have a pregnancy, they would get a blood transfusion every trimester. There's some kids that get a blood transfusion every other month. It's like hypotransfusion, so yes.
That's why we go
I'm
to
a
school.
blood donor.
Yeah.
Oh, wonderful.
I got my blood mug, as I call it.
Yes.
That's the reason we go to school with when they're born with sickle cell disease, because we with this patient, when they're born until they're not here anymore. When
Right.
they start in the school from kindergarten, we there to, with the principal, to plan the 504 plan or the PPP,
Yeah, and
Yeah.
their
to
SSI. so- yeah.
exercise, everything to work with them that can help them to not get back in school. You know, because sometimes in transfusion, when they get the transfusion, they stay in the hospital for 3 weeks or a month or 2 months. That means they will put them back in the school. Now with the 504 plan, already that protects them, you know, give you homework before time.
Right.
From, you know, more, a little
And
bit
to-
more than the other students.
Right, and to
put it out.
work with the nurses and the teachers to help them to understand that the kids don't want people to know that they're sick. So when we get with the teachers, we let them know, if the kid can, something like that. I mean, I need to go to the bathroom. Not, oh, well, Rob, you can go to the bathroom now, but so that they have a relationship between them to let them know.
Oh, I'm sorry.
The other thing, as I said earlier, about health disparities. Health disparity happens as it relates to the sickle cell kids because throughout their lives, they're being medicated. And unfortunately, they get labeled. A 12-year-old may get labeled a drug seeker,
Yes.
and
That's the health
right,
disparity management
you know,
treatment,
right,
the
the
labeling them in
labeling.
the hospital.
right,
I don't like to go to the hospital, or they're drug seeker.
yeah.
They're not treated well either. That's what we're fighting for years
Because
to
they're just-
educate.
Because they're anemic during the day, they're just,
No, because they're enduring a major crisis.
Major crisis.
why would they be labeled a drug addict?
Because they constantly are being medicated, thank you.
Oh, they are medicated.
They are, that's
medicated.
right,
Oh,
Yeah, all the medication they use.
There
yeah.
is, there's, for example, there's a specific pain crisis that only the male young men and men go through, and it's called priapism. And they can get an erection that could last for days, and it's extremely painful because of the blockage. The cells are there too. Some of them wind up being impotent. They have to have, ongoing management, with urologists and those types of physicians. But yeah, there's so many things surrounding the management and care. of a person with sickle cell disease. Because of course, if at a year old, a child encounters their first crisis, and they probably wind up with something like Tylenol with codeine, you know, and they're graduating, you know, maybe one day it may be morphine, oxycodone. So where do you expect them to be when they're 18 or 19 years old? Where do you expect them to deal with situations that there are things that they can't participate in? One of the things we worked throughout the years with Hiram Camp, because we were able to send our kids there and worked with the staff there. When the child has sickle cell, if they get in the pool, the minute they get out, they have to be dried off completely. They could go into a crisis.
When do we have that at Camp Forbes?
We've been there before,
Yeah.
yeah.
Are we working with you?
We used to.
No, because we had the staff and the hospitals, you know, so close. If the child was being seen at Metro, when they get that call at night that he's in crisis, we didn't want mom to be all over the city. You know, we're gonna have him there at Metro within the next 30 minutes. Meet us there. The same with UH, the same with Cleveland Clinic.
I know that a while back with sickle cell anemia, the employers didn't understand it, and they thought they were drug users, and they would terminate
Yes, they
sickle
would.
cell anemia people,
Yes.
you know, and it was just so sad.
Yeah, because when you look at, let's say a person with sickle cell started a job today, and they had 90-day probation, but in between there, they wind up in a crisis that put them in the hospital and at home for 10 days. That job is gone.
Yeah, that's true.
Yeah.
That is true.
Yeah.
Now we have a success story from them too, because we have people with PhD with sickle cell disease. We have doctors. We have sickle cell disease. We have most of the administrators who are, they go to school, they go through a lot of struggle, but they reach their goals. A lot of them, thank God, in these years.
One of our board members actually has his PhD, and he has sickle cell. Matter of fact, he lost his brother from sickle cell as well.
That's not good. That's so sad. That's not good. That's not good.
Has that been changed through the HR system, knowing that sickle cell disease, how it has been inherited with a lot of people? Have they tried to incorporate that medical situation in the policies and the procedure of the HR?
I guess it would be, how the employer feels as far as that person's position. Yeah, that they would have.
I got experience. I got
Yeah.
that situation. We run with a lot of people who lose their job, and they don't have depending where they're working. Human resource, they don't have any protection for them. Some of them, they would follow only the rules and regulations they have in that company, and they have to follow it.
So you have a lot of them on SSI or disability, and all. So yes. And I've been involved working with the organization for a long time, and
Yeah, you mentioned a lot of people.
She's the
Oh,
last
yeah.
of the Mohicans,
Yeah,
like I
yeah,
said.
Yeah, it's
Back in the 80s, when you started in the 80s, yeah,
Yeah.
you mentioned it, that was in the 80s.
and it's there are things that I feel that have not materialized that should. Some of these stories that you hear that people are dealing with sickle cell should not be. But you have an institution out here, whether they make those decisions are not up to us to do it. They have to do it. There are some of the hospitals now that are implementing emergency room protocols where they come into the emergency room, they're hydrated, they're medicated, they may be observed for 4 hours or more and then released home and all. But the days are over where sickle cell and cancer patients would get a prescription for a narcotic like oxycodone, PRN. You know, I think it's, some of them's like 7 days, you have to return and get a new prescription and those types of things.
Has the death rates decreased over time with this?
Yes, it has. Yes, it has. And as a result of early diagnosis. But as far as those patients who are adults that have been out there, you know, coping with this awful illness, the death rate is about the same.
How much percentage is that?
It all depends. It's hard to say. You know, a lot of times when a patient has died, the family is so caught up in the grief that we won't even know about it for a couple of months. Or we, you know, we don't have like a budget, but we have the ability that we will help them with funerals. Maybe it's a small amount.
Not that much.
It's not
but,
in the
yeah.
thousands or anything, but we get calls, you know, can you all help with the repast? Can you all help with the family flower for the casket? Can you all help with the initial deposit to the funeral home so that they can know that we're in good standing and that type of thing, but yes. But, you know, we still have deaths, and those deaths are associated with chest syndromes, strokes, you know.
I was going to ask you about that. What about the high blood pressure too? You got the sickle,
All of that, yes.
included
The
the
medical
blood pressure.
blood pressure, yeah.
Yeah.
It's a kind of risk
Yeah.
for stroke at a time. Yeah.
Wow.
But one of the things that we want to make sure we leave with the council is that you don't have to be black to have this illness, and that we work with all the races and all of the
100%.
communities, and we are citywide. And I honestly feel that this is something that Cleveland should be very proud of, that they have a community-based program such as ours, you know, and we get referrals from all over. And in helping them, you know, we had a mother who had her baby died as a result of sickle cell, and I think it was SIDS as well. And, you know, we do Christmas types of programs for them. And, you know, it was like, well, when she called us for us to take care of the kids for Christmas, and we asked her, well, what is it that you want? She said, nothing, as long as you take care of them. Those are the things that we really look forward to, working with parents and families to help them to be able to navigate through this chronic illness that comes with so many issues, whether they're psychosocial or social. There are multiple issues that they come with. Sometimes they may call and say, well, I need food. My food stamps have ran out. Can you all help me? We've been able to work with people to get beds, you know, just working to make sure these people understand that there is something there to help you, you know, through this unfortunate journey that you will be going through.
So what did you move into the election groups?
In the last 2 years, this is going on our second year.
Second, it's gonna have second year
Yes.
in August.
I used to go
Yeah.
down there to the Cleveland Clinic exercise program.
They still have it.
They have it, they
Yeah, they still
have
have
it.
And due to COVID, they shut down for almost a year until it opened up, like everyone saw open up after COVID.
Yes.
Everybody started easing in. They kept their facility closed longer than expected. So when they reopened back up, I did not go back down there because they had the exercise class on the top and you have the super class. So we were there through the weekend. Through the week it was packed. So
Were you on the second floor?
we was on the second floor.
That's where we are.
And at that time, on the first floor, the other center for the senior citizens used to be on the first
Okay.
floor. They got the
What's that? I'm looking
program
at it
out
now.
there in East Cleveland, Big Hospital.
Oh, Stephanie Tubbs.
The other center, it was related to Stephanie Tubbs.
Oh, okay.
It was the other center. But anyway, they had the senior citizen center on the first floor for years, and then they left before COVID.
Okay.
And then it remained empty, so I haven't been back, you know, to sign up for the exercise
okay.
program on the second floor, so that's why I asked.
Yeah.
What you guys.
This is going on our yeah, we're on the second floor.
Second year.
This is
Second
going
floor.
on our second year there. We were in the DD building for 11 years.
Okay.
And then we were in the EE building for about 20 years. And then we got moved into the outpatient surgery building while they were putting together where we would be going. Yeah. Yeah.
So
It is, it really is, yes.
we need this to get more people alert.
Mhm.
My assumption, and this is what I was assuming also, that in my ignorance, I was looking at it mainly being for, you had to be black. But I knew about the Mediterranean, I knew about the Arabs, and the Spanish, and the Latinos, but then you guys brought it out for me. I didn't, wow. My assumption is some people, they probably, when you look at other diseases, they probably, it's my assumption, think of it really mainly as African American disease. And so that might be the pushback, I guess, I don't know.
Well, you
But
know,
we want to help.
You know, the first president that actually designated specific dollars for sickle cell was Richard Nixon, of all people.
Yeah.
Wow.
He wouldn't say AIDS, but he would. Interesting.
Yeah, everybody look, you messed me up with that Richard Nixon, man. Get out of here. Wow.
Yeah,
Wow. Wait,
Yeah.
what messed me up like that for? Golly.
yeah.
Was it his wife? Because, you know, his wife was very engaged and,
Wow.
No, it's him.
Yeah.
Yeah, because during that time, and I hadn't gotten there yet, but during that time, there was a lot, the atmosphere, if you will, for politics was totally different then than it is now.
Yeah. Totally
And
different.
all, and you had the Black Panthers, you had Huey Newton, you had all of them.
CWA.
And all that really, when sickle cell came about, it was like, you know, what the military was even in it because they were trying to keep young men who they had identified with the trait out of the military. Because, you know, if you have the trait, if you fly in an unpressurized aircraft, you're going to have some problems. But all of our planes are pressurized. If you go scuba diving, you're going to have some problems. Mountain climb, you're going to have some issues and all. And so,
That's when it come to me to do research when they
Right.
travel. Because when they go to Europe, I'm looking for the hospital for them to convenience them. If something happened to them, they can go near of the boat or near the airplane. Or something happened to them, they can go to take care over there for the sickle cell disease. Yeah.
So what kind of policy do you think you might need in the city or downstate to help us out with this, with the sickle cell anemia?
well, to legislate actually necessary, see, let me put it to you this way.
You know this is Minority Health Month.
Yes.
Kicking it off.
Yeah,
There is no line item in the budget for sickle cell. Our funds actually come through the selling of the kits to the hospitals. And that funding goes through Ohio Department of Health. And it's usually, for the whole state, $700,000, or a little over $700,000. And that's split up between the regions. There are 6 regions. And so until they do something in direction to that, and there is a group that's in Columbus that actually speaks to the legislators.
There is, I was wondering.
Yeah. But, yeah, it's, when you have the newborns, as I said before, who are screened, and it's mandated, all 50 states do it now, that dollars is earmarked strictly for newborn screening. And under the newborn screening comes the sickle cell. For example, you may have, we just had a recent add-on called Krabbe. And Krabbe is a genetic disorder, Krabbe, is a disorder that affects 1 out of 100,000, but is now a part of the newborn screening package that's done on all babies at birth.
Could you, because I don't know, so I'm asking, I don't know. I know we take money out for Harvest for Hunger.
Yes.
Is there, do United Way include you guys in with
You know,
the,
when they went under, excuse me, Counselor, when they went under new administration, our program was one of them that they stopped funding, and there was a list of health organizations that United Way chose not to fund anymore, and that was under Augie.
Okay, good.
Yeah, it was under his administration that
Already
occurred.
funded, right?
No,
Augie
right,
didn't fund
no, it was under his administration that we no longer was funded, as well as the person that was before Augie. His name started with a K.
Well, probably not.
Yeah,
Yeah,
so,
Augie
But-
just retired
Yes.
last year.
but what happens is, if someone wants to participate with United Way, and let's say they say, well, I want to give $200 of my employees', salary to American Sickle Cell. All they have to do is write that in, and that money would come to us minus the administrative costs. And so we do have people who have continued to designate their funds or their payroll deductions to us, as well as other United Ways around the country. You know, we may have New Jersey.
New York,
yeah.
Philadelphia, yeah.
I think we have a couple out of Columbus, somewhere in there, yeah.
Have you reached out to Mayor Bibb? Have you talked with him?
No, I just sent them a Christmas card.
They might could do it through payroll deductions. They might want to donate $1, $2, whatever the case may be.
Yeah.
Reach out and talk with the mayor about it, you know him, right?
No, I've not personally met him.
Should she talk with the personnel director or to the mayor? Because you gotta go to the administration. You don't legislate.
Maybe one of the mayor's staff or maybe somebody in their job. Because the various jobs that I had in my life, that I worked at, which is University Hospital, University Hospital.
Yeah.
And HR, I worked at various positions, HR, medical records, and audiology. I was there for 9.5 years, and United Way always had their funding. We had United Way funding taken out of our paycheck, per se, and KeyBank had done it, and also worked in Cleveland Clinic. So we always contributed through our paycheck to those organizations. So that's a good idea that you brought up, but I can say, you should start. You can start with HR and or maybe somebody is one of his staffers who's over that area that works with HR.
Yeah, I could set you up with that today, walk you in with human resource, set the meeting up, talk with them. That way we'll have some options, and then,
Is that Miss Tony Tell?
oh, no,
Oh, okay.
Tony works for us.
Okay.
That's Matthew, what's the, you hear me talking about him right now, it's because they always listen. It's what Matthew last name? The new guy with human resource, real good.
It's like a very, hold
I can
on.
walk you when we leave here.
Yeah.
We'll set a meeting up, and I won't leave you out there hanging by yourself. I'll sit in a meeting with you, and then we could.
Matthew Cole. Matthew Cole.
Okay, I'll introduce you to him. And then even when we meet with my wife, I would like to say do the same thing for
Okay.
Chris Ronay over at the county. Because you gotta constantly keep raising funds to help you out. Because you're getting cut out here, you're not
Yeah.
way, but you need friends to walk you in those. So we'll do that. I'll do my part.
Okay.
All right?
All right.
Thank you so much.
Yeah.
I want to set you here, and there's no outcome measures. The
Okay.
outcome measures, we donated, council did. Now, when council donated you the money, they cut CDBG. They used to receive funding sickle cell anemia with CDBG money.
Right.
Council lady and Councilman Harsh. And they used to be, I'm sorry, Council lady. And the reason they came over to me, I'm walking in, they're waiting for me as I walk in. I know about sickle cell. And they were cut out of CDBG.
Yes. I was devastated.
Right. And they took, what was it, 30-some thousand
Uh-huh.
dollars
Yeah.
from, that's what you guys donated to sickle cell at the time. And community development sent them a letter, and they just pulled them away from receiving city funding.
And they said it was for a different direction. Youth violence, the seniors, and there was one other,
There was another one.
housing.
Yeah, housing, yeah.
Housing. And that we did no longer fit.
Health was
in that.
not there, yeah.
Health was not there.
Youth violence, seniors.
And housing.
The seniors get sickle cell also. Youth gets, receive sickle cell. It's in that same paradigm.
Youth violence. Yeah.
Right. So we, I'll walk you down. We'll talk about the director. I'm not going to say things that we don't execute on it. So we'll do that. Council members, I reached out to Anthony Harrison, and I'll see him today. He chairs. Well, what committee is that? I've never said that. DPS. He chairs DPS. I mentioned it to him. And he was happy about it. So, gotta try to get you in there.
Well, it's desperately needed, it really is. You know, even with just upgrading our equipment. You know, we just did computers and all now. Because we also work, Councilman, with the NCBA, the National Caucus on Black Aging.
So go back to your equipment. What, because you know we do grants and loans for forgivable loans for equipment here also with, over the economic development.
Okay, because we desperately need two new computers,
Two more computers.
yes. Because what happens is that we get the NCBA enrollees, and a part of that program, National Caucus on Black Aging.
Okay.
And what those are, you know, older seniors, 55 and up, that requires training. And we provide them with training, like they'll assign us two, we have three now, and as a part of that, we work with them with teaching them about the computer,
Data system,
you know,
data input.
data,
By patient letters to send. for
scheduling
patients.
appointments. And actually, what we're supposed to do is to provide them with a job. But because we do not have the funding, we have not been able
Hire
to hire any of them. And the program, NCBA, has supported us at all with the fact that we don't have the funds to do it. But to have those individuals on our staff to be working to help us to make sure that our program is both quality and quantity of services, we need hands on deck to do that.
Yes, there's resources in the city and the county, like we have workforce. Workforce could definitely work with you as stakeholders and partners. So you can work with workforce also, and I'll mention that with Matt, talk with them.
Okay, that's good.
Take a look at that, 'cause we have job developers and workforce that could help out with that.
You know, just like that number that you saw there with over 325,000 units of service, we're getting ready now to actually have Iron Mountain to destroy about 20 years because the cost keeps going up
Get them out, yeah.
for them to maintain our records at Iron Mountain, because we have those 50 years that, you know, and all. And people they would call in, well, my baby, when he was 5, he was tested, do you have those results? There was a time that we could go into a storage room
Oh, my God.
and pull the year, but then when we had to
1960s,
be,
70s,
right.
80s.
Right,
No
when we
longer
had,
like that.
when we had to be relocated, we had to now pay a storage company to house that for us. But the board has voted, of course, that we need to, in order to reduce that cost, at least let there be 20 years of this road. Yeah.
So I know about it. Any other questions?
Well,
Council lady?
You said about the workforce, among the workforce with, Jasmine Santana, she's the chairperson, as well as many others. We put that $10 million in our job meetings. And when you said there are jobs available, that's something that can also be looked into.
Oh, yeah.
Dealing with giving training and the skills
Right.
from our job meetings, but that's what they do. And that was part of the proposal that they brought to the table, is to send everyone there at our job meetings so they can get the training skills and the learning skills that they need to find a job and what they want. Not what they want to give them, the job skills that they want to train them on, what they want to receive in. So that's, I just wanted to add that on to
Yeah,
what
that
you
is-
said about that.
I think Council Lady, I think Matthew is their boss. Now, I'll just make an introduction. We'll call and just come out and meet with me. We'll go in the back room and we'll discuss, the Council Lady just mentioned, and, because the stakeholders and partners, especially when you have high inflation, because that's affecting your costs. So now that institutions have to work together, so we can do that. So let me see what I have here.
And, we certainly would invite each council members, if they're in the neighborhood, to come and see, where, the
we are.
area where we are and all, and our patients.
That's right on Black Griffin. That's where it's-
Yes.
Oh, that's
Oh,
my
yeah,
favorite.
yeah,
Griffin.
right, that's right.
That borders with Profile.
Oh, what's that?
That's bordered with Profile. They, because Landis and 79th and Quincy and Woodland is on the other intersection.
With Star?
With Star. They connect on that end, and if you go across Woodland, that's their end, because I'm up a little bit further on Woodland that turns to Buckeye.
I think it's better probably to invite them to caucus. Who sets the caucus up?
Blaine, come on.
Ah,
He's our president. Set the
yeah, he's your councilman. I'll just talk with Blaine.
Okay.
He's there.
Yeah, he's sitting an email.
Yeah, we talked about it.
Yeah,
and,
they sent me.
he's there. I'll mention to him today, and we'll get that done. We'll get that done.
Also,
I
Ellen
need
Dreyer,
to see what
Ellen Dreyer, he
Right.
also, he helps with that, setting that up.
we'll set that up. I'll introduce you guys. Let me see. Caucus. That way they know. And Matthew of Human Resource. Okay. And number 3, jobs. Workforce. Okay. Just we said a lot, and I'll just do the laundry list. Okay. Any other questions?
That's it.
Thank
And
you.
we'll go down and see Matthew right now and set that up, and push come to shove, then we'll talk with the mayor as well, and we'll move forward. And you might even get lucky and get put back into the
CDBG program or? Okay.
CDBG.
Okay.
What, let me tell you, we're not gonna leave you out there, as we would say in the neighborhood, hanging.
Mm-hmm.
So we're there. You came, I came through. You reached out to me, talked with us. We're there. So walk you in the Matthew office now. I'll be there 100%. You got one of my favorite people, Pam Bradford, there.
Yes, she's the
Pam.
chairman of the board.
She's the chair of the board.
Right, tell her I said hello. She could have stopped by and said hello to us. Pam, she knew my children when they were younger.
Oh, okay.
You know.
Her father was one of the founders, Dr. Wright.
With the right.
She never told me. Never told me about it.
She never, yeah, she never really mentioned it. She never.
To Chris, Pam Bradford, and Rebecca Morrow, council lady, she was over a group called Rap Arts. That's where I met her. And so, like, you see children out here in the neighborhood just doing whatever they're doing. So her program, Rap Arts, would help children, teach them principles. reading, writing, arithmetic, all of that, and quality of life issues. So I met her, we've been friends since the 90s. And man, she would have hundreds of children. It was located in Cleveland Heights. However, kids would come up from throughout the city. And they didn't have all this. When you see kids with guns, and a lot of her children, either they went to trade school or they went to college. It's the untold story from Rap Arts, and that's what I know Pam Bradford from.
And what's his name was a part of her staff, Tony Silas, who is now executive director of the Carmel House.
The Carmel House. Yes, Tony was part of
yeah.
their staff.
He
that's
was
right.
the, I think
Tony
Art
Silas.
says.
Yeah, Tony, right, Tony was a little
Tony
young
Silas.
guy.
Yeah.
I forgot Tony was with her. Because Tony taught, he taught acting, and he taught actresses.
Theater, yeah.
Yeah, and one of her people went to the young lady ended up being on The Wire.
Oh, wow.
Had a part on The Wire.
Okay.
I forgot the young lady's name, but she knows her name. She said, Catherine, remember, that's her. I sure did. And she was on The Wire, and I think she was a detective or something. She was on it. A couple of I forgot the lady's name. Brown skin, African American female. Was on The
Wasn't
Wire.
that the lady detective? Wasn't her name Takima?
That might have been.
She was like a major character. She was
Yeah,
like,
but they
like,
went through
Oh,
her.
wow.
they all
Okay.
like,
Yeah. And Tony
Yeah,
Silas and
okay.
some friends too.
Yeah.
Yeah. You never watched The Wire? The Wire is good. It's similar like what we doing.
it's like the only.
It's similar to like what's going
Oh,
on in
okay.
Cleveland.
Okay, yeah, yes. Yeah, Jonathan watched The Wire.
The Wire, okay.
Bay, isn't that her name?
Yeah.
That's her. Hey, where you know?
Because I watched the show.
Yeah, because she's Morris. She's from
Yeah,
Morris.
that, yeah.
Those Bays are Morris. Bays in the E Hills and Morris. And yeah, I like,
She was a great character.
wow, man.
Cleveland, I want to know about
Yeah. We talked with Tony.
All right.
And I Pam might still have a relationship with her.
Tony Silas? Oh, with the
Yeah,
young
Tony
lady,
Silas with
okay,
the young
yes.
lady.
Yeah.
I remember when she left and she was headed out to California. She told everyone goodbye. And she went out. The next thing I know, and the wife was watching on the wire.
Yeah.
I'm like, get out. So,
Yeah.
good outcome measures from what,
Okay.
you know, she's an untold story, Pam Bradford, untold story. And when I heard, I said, you know, we have to move
Yeah.
forward. So we will continue to keep helping. You just
Okay.
have to reach out and let us know. Council members are extremely busy. Our awards are the size of most cities,
Yeah.
you know, and we get calls for everything. A council member will never ignore you. It's just that awards are huge, and you have so much coming at you. But if you let us know, or you let Tony know, Tony Taylor you just mentioned, and then we get in the mix to help. But we gotta know. So that's what we're at.
Thank you so much.
With that, I gotta take you down to Human Resource.
Okay.
The Health and Arts Committee is adjourned. Thank you.